Hi, my name is Prof Chrysis Sofianos, and I'd like to talk to you today about facial rejuvenation. If you've had facial rejuvenation on your mind for a bit, this video aims to explain some things about deep plane facelifts and guide you through it. So deep plane facelift is a specific facelift technique that aims to not only reposition the skin or just tighten the connective tissue, but rather move the deeper layers of the face to lead to a more natural looking facelift. Previously, we used to mildly tighten the deeper connective tissue layers. These days, in a deep plane facelift, we go underneath these deeper connective tissue layers and tighten them in a certain vector to give you a natural looking result. So I started performing these facelift techniques in 2019, and I've exclusively been performing deep plane facelifts in Johannesburg, South Africa since then. So if you're in your 40s to 70s, you've noticed some sagging, especially in the jowl or cheek area, you're likely a good candidate for the procedure. Although each procedure is tailored to specific individuals and a consultation would guide you in the correct direction with regards to that, usually there's no set age for the procedure. However, objective signs of aging is the first step in that direction. If you want real results with a natural looking lift, a deep plane face and neck lift is probably the right procedure for you. So the deep plane facelift procedure is done under general anesthesia, so you're asleep for that procedure. We use a technique called total intravenous anesthesia, which allows a good recovery from the anesthesia. It takes about 3 to 4 hours. It's done, as I said, with you asleep. We start off with an incision in front of the ear. It usually follows the hairline. And if we're doing a deep plane neck lift as well, this incision continues to behind the ear, where we separate the face into its separate layers. We lift up the skin. We then see the deeper connective tissues. We make an incision in the deeper connective tissues and we pull these in an upward or vertical direction. That is the vertical restore component of the deep plane facelift, and that was popularized overseas. Once we've lifted it up into the correct position, we put stitches to hold the connective tissue in this new position. By lifting it up in a vertical direction, we address the sagging, we address the cheeks, we address the jowls, and then if indicated in your procedure, we also address the excess neck laxity. Once we've put it in the correct position, we then close up the skin with stitches. You then go back to the ward. You're with us for one night. You do wake up with a garment on just to support the face, and you're then discharged the following morning. It is a surgical procedure. It does have recovery attached to it. So with surgical procedures, there's swelling, there's bruising. That starts to subside at about 10 to 14 days, with most of the bruising and swelling gone by about 3 to 4 weeks down the line. There's very little pain. We manage that with a number of steps. Most patients are comfortable. You do wear a garment for the 2 weeks, but that supports your healing. After about 2 to 3 weeks with the swelling subsiding, you then can get back to normal sort of exercise, lighter activity. Most of our patients are active with day-to-day work, day-to-day activity at about 10 to 14 days. So a lot of patients come to me worried about the pulled or unnatural facelift look. There are certain signs in the older techniques of facelift where one could take a look and say she or he has had a facelift. The aim of the deep plane face and neck lift is to try and give you as natural a result as possible. By using different vectors, by focusing on the deeper connective tissue layers, we aim for a more natural or refreshed look. Unfortunately, no surgery is possible without scars. However, these scars are usually hidden within creases or within areas that are less visible or less noticeable. By pulling in certain directions, we aim for a natural or refreshed look. So the cost of the procedure does vary from patient to patient. As it is a cosmetic or aesthetic procedure, it's not covered by medical aid. The deep plane facelift can be combined with other procedures such as upper or lower eyelid surgery, lip surgery, facial resurfacing, and that's why consultation is necessary to decide how much a procedure could possibly cost you. So a question I get asked regularly is how long will a facelift last, or how long do the results last for? A facelift technique that works on the deeper layers does give you more durability. So where a normal facelift could last anywhere between 5 to 10 years, with deep plane facelift techniques, we tend to say that these last between 8 to 15 years. Obviously, results are individualized. Different patients have different results. But in general, the deep plane face and neck lift techniques last longer than other techniques. If you found this helpful, give us a like, share it with someone who might be interested, drop us a comment. If you think you might be suited to this procedure, get in touch with my office. We have various offices across Johannesburg. We offer both virtual and in-person consultations, and we look forward to hearing from you.